Okay, so we're looking at these are basically two issues that they are usually what occurring together, and especially when they occur in children. Okay, the worry is more. Okay, so this is restricted movement or refusal to bear weight. Refusal to bear weight is more of like in your whether your hand. Okay, you can be able to carry something, but when there's an injury to your hand, you don't want to use it to carry anything. You understand? So restricted movement is you are not able to use that part of the body like you used to. You understand? Due to some issues to the joint. So what we have is this: restricted movement or refusal to bear weight in children is a red flag in pediatrics and also orthopedics. You know, so it often indicates that there's a serious underlying issue. It by itself is not a disease, okay, but of course a disease should be causing it. So it could be caused by septic arthritis, where you're having acute pain, fever, refusal to bear weight, restricted joint movement. Okay, you can also have what osteomyelitis, where there's a bone infection, where there's a lot of pain in the bone, there's swelling, there's fever, and the person doesn't want to use that limp like they used to. Okay, then inflammatory and reactive issues like what transient synovitis of the hip, which is common in children. So the child is refusing to walk or limp, but usually what afebrile and less toxic than septic arthritis. It can also be what juvenile idiopathic arthritis. These are the things that you'll be suspecting if you see a patient with such presentation. Then traumatic issues like there could be fractures or dislocation, you know, occult fractures like the toddler fracture of the tibia, you know, soft tissue injuries, sprains and muscle tears. Okay, so clinical approaches: first of all, you have to take history, what happened, what went wrong. Okay, you do examination, you do investigations like those blood tests, complete blood counts, erythrocyte sedimentation rates, you know, C reactive proteins, you do x-rays, then you do ultrasound. Okay, then joint aspiration, if there's like, how will I put this, if the joint there's like accumulation of synovial fluid there, you basically was reduce the, you know, amount. So that's what we have for restricted movement and refusal to bear weight, especially in children.